Today, I'm going to concentrate on the hypothalamic pituitary adrenal axis because I can't cover the whole of endocrinology. And this is one that is particularly important, and it's one of the first ones that we are going to be able to monitor relatively easily. So just to remind you that the control of the hypothalamic pituitary adrenal axis is at the hypothalamus, just above the pituitary gland in the brain. This sends messages to the pituitary gland, which releases ACTH, which goes round the bloodstream to the adrenal gland, and the adrenal gland then makes the hormone cortisol. Now, there are three major take-home messages that I hope you will be able to get from this talk. The first one is going to be able to describe the importance of dynamic changes of hormones. So not just how high or how low the level of a hormone is, but that it's important that the level of the hormone is changing throughout the day. And that is important in the way that it works. I think I'd like you to be able to understand the importance of the time of day for therapeutics and the time we give you therapy. And I'd also like to be able to describe the new techniques for measuring hormones across the 24 hours. Can I have the next slide, please? So first, why is cortisol so important? Well, cortisol, you've got cortisol receptors in almost every single tissue in the body. In fact, it's the only hormone that is actually vital for life. Without cortisol, you just can't live. With other hormones, you can feel awful without them, but you can actually live. So cortisol affects your immune system. It can affect your heart, your blood pressure, your blood sugar, your digestive system. And of particular interest to me is the way it affects the brain, because it has major effects on anxiety, depression, headaches, and how you feel, your feeling of well-being. Now, it affects all of these systems in the body, but what I want to get across to you is that people think of cortisol as being a stress hormone. It is in a way, but what it is much more is it is an anticipatory hormone. It's a hormone that goes up in an anticipation of your needs. So basically, it goes up before you need having cortisol around. And let me explain this in the next slide. Now, we live on a planet that's going around every 24 hours. And this means that we spend half of the day asleep and half of the day awake. Your body functions in very different ways when you're asleep than when you're awake. And what's really important is that your body gets ready for waking up. So it is prepared for the next day. And in order to do this, the level of cortisol has to go up in the morning. And the next slide, please. Now, what we can see in this slide, and this is a slide in the 1990s, is that whether you're short, tall, normal, whether you're a girl or you're a boy, your levels of cortisol go down at night, quite low levels, and then in the middle of the night, they start going up, and then they peak early in the morning, and they go down during the day. And this was always what was accepted as being the normal circadian rhythm in humans. But the problem with this is that it didn't take enough samples from each individual. And when you take multiple samples from one individual, can I have the next slide, please? What you actually see is this. So certainly you have very low levels at night, but then early in the morning, about 3:30 in the morning, you start getting these huge peaks of cortisol, which reach their maximum at about after waking at about 8 or 9 in the morning, and these peaks continue throughout the rest of the day. Can I have the next slide, please? Does this actually matter? Well, first of all, let me tell you what it means in terms of diagnostics. So let me show you here, because your cortisol is going up and down during the day, it means that if you take a sample of cortisol at one point in time and you take it, say, half an hour later, it might be vastly different. So what I'm showing you here is cortisol levels in 200 normal people. And so every single point here is normal, okay? So every blue point you can see is normal. So this is at bedtime. You can see the great majority of people's cortisols at bedtime are quite low, but some people's aren't. And these are all normal subjects. When you wake up in the morning, all of these levels of cortisol are absolutely normal. And then 30 minutes after you wake up, you can see there's a huge range of normality. So the bottom line here is that if a doctor takes a cortisol estimation, one single cortisol estimation, it tells you absolutely nothing, because almost nothing could be normal, because this is normal, or very high levels can be normal. So if you just take one sample at one time, this is not helpful. It really tells you very little indeed. And a lot of people in the wellness market are telling you they can take a salivary cortisol from you and tell you whether you've got enough or you don't have enough cortisol. This is absolute rubbish. It tells you absolutely nothing at all. And next slide, please. What happens during stress? I don't know if any of you ever went to Disneyland. Did any of you go to Banks's Disneyland? Okay, well, this is just a joke slide of somebody being attacked by a lot of seagulls. You know, if you go to Western Superman, you have fish and chips. All the seagulls want to eat it for you. Anyway, now the next slide, please. What happens when you're stressed? Well, this is just showing you what happens when you have cardiac surgery. This is in 20 patients, the mean of what happens in 20 patients, you get a huge surge in cortisol. But this is when you mean the level from lots of different people, and it looks really tight, doesn't it? What happens when you look at one individual? Go to the next slide, please. Go to the next slide. So this is one individual undergoing surgery. So they're having surgery now, and you'll see they get these huge peaks in cortisol, which happen after surgery. These peaks are absolutely massive. So it's a fundamental aspect of your cortisol secretion that it is released in major big pulses as you go through the day. And if you stress somebody, these pulses get very much bigger. Have the next slide, please. So the next question I want to ask is, do these pulses give you physiological consequences? Are these pulses important? And so first I'm going to look at cognitive and metabolic function. And I hope you don't mind that I'm going to show you some of the rodent work we did. So this is work we did in rats, because I don't think many of you would like to come in and have me record individual cells in your brain while I stress you. So can I have the next slide, please? So just to remind you, a rat is nocturnal. So it is awake during the night and asleep during the day. And so it has a normal rhythm of they secrete corticosterone, which reaches a peak just after they get up at night and then goes down during the day. Now then, what I'm looking at here is cells in the hippocampus, and these are cells which are really important for memory. And I don't want to go through this in detail, but if you stimulate these cells a lot, they remember being stimulated and they become more responsive. So what's happening here is that these are stimulating the cells normally. Then at this point in time, I stimulate them a lot, and then I give them normal stimulation again, and you'll see that they respond to the stimulation very much more than they did before. So basically, this is the correlate of memory in the rat. This is how a rat's brain remembers things. So I'm looking here at ZT12, which is basically this time here after they've woken up. And you see they have this lovely, we call it long-term potentiation. But if I look at the same thing at a time when the rat's asleep, which is ZT0 here, they don't respond at all. So that's basically like saying to you that if I wake you up at 3 in the morning, your memory is not very good. But if I wait until 10 o'clock in the morning, your memory is much better. But we have an objective way here of measuring their memory. So is cortisol important for this? Have the next slide, please. So what we did here was that we gave the rats a very low dose of cortisol, enough to get rid of its circadian change. So the levels of cortisol in the rat corticosteroid were the same over the whole day. And you can see that they got no long-term potentiation at any time of the day. So you abolish the daily rhythm of cortisol, you also abolish the daily rhythm of the way their brain is functioning to remember things. And so the brain isn't functioning so well. So basically what I'm showing here is that the rhythm of steroid in the rat is very important for the way the brain works. Can I have the next slide, please? Some of you may have taken steroids in the past, and if you do, you may remember that it has quite a strong effect on your appetite. So what we did here was, so remember that this is the normal pattern of corticosteroid in the rat. What we did was we took their adrenals out and we replaced their corticosteroid rhythm in a normal pattern. So this is the normal pattern of corticosteroid, or we reversed it. We gave it back to front. So basically, these animals have a normal light-dark cycle. They have everything about them is normal, except I reversed the way they get their corticosteroid. So what we see here in the animals that have a normal pattern of corticosteroid is that they're awake at night and this is the amount of food they eat. They eat when they're awake, and then and in the daytime when they're asleep, they don't eat. They don't eat when they're asleep. They eat when they're awake. They don't eat when they're asleep. They eat when they're awake, and they don't eat when they're asleep. However, if we reverse the cortisol, so we give the cortisol the opposite way around, you can see they eat all the time. It's completely changed their eating pattern. So the important thing about this is that both types of both rats are having exactly the same amount of cortisol throughout the day. The amount of cortisol they have is the same. It's just the pattern is different. And so what I want to get across to you is that we don't only think in terms of the dose or the amount of cortisol, we have to think about when it's being given and when you're receiving it. And this part of the slide here, which I'm not going to go through in detail, basically shows that the genes in the brain which control your appetite are regulated by the cortisol. So that the genes that turn on your appetite are being turned on at the wrong time when we give cortisol in the wrong way. Can I have the next slide, please? What about in humans? Well, we can't do exactly the same things in humans, but what Konstantinos Kalfatakis and Georgina Russell did was they gave their cortisol replacement either totally smoothly like this, or they gave exactly the same amount, but in a physiological manner in pulses throughout the day. And they compared the effect that it had on their subjects. And the next slide, please. The next slide, please. And basically, what I'm showing you here is if you look at a normal individual, so all of you in the audience, if I show you pictures of people smiling faces and unhappy faces, it is normal that you tend to look at the people who smile. It's just a normal thing that we do. If you have a choice of looking at an unhappy person or a happy person, you look at a happy people. And this is really very interesting because it means that we can show to people a whole series of faces and we can record which faces they look at. So the people who got the normal physiological pattern of cortisol, when they don't look at fearful faces very much, but they look at happy faces much more. So that is absolutely normal. But the people who had the smooth pattern of cortisol looked at fearful and happy faces just the same amount of time. So all I'm getting across is that the pattern of cortisol that we give you is important in your mood, in the way you look at things, because it's people who are depressed tend to look at happy and unhappy faces the same amount of time, but normal people don't. They look at happy faces more. And also, I won't explain this, but when we look at we look at the connectivity in the brain, the connectivity in the brain is different in the patients given the pulsatile pattern. So again, what I want to get across is that it is the pattern of cortisol your brain sees is very important for the way the brain works, not just the dose, but the pattern that the brain actually sees. Go to the next slide, please. We also then looked at patients who had, so that was all normal subjects, and we then looked at in patients who had adrenal insufficiency. And the bottom line here is that when we give the pulsatile treatment, they had less fatigue and they had improved mood and vigor. They both groups, these patients had exactly the same dose of cortisol, but they either had smooth cortisol or they had normal pulsatile cortisol replacement. And so the patients on the pulsatile cortisol felt very much better. And I can tell you that these patients are still contacting us because they want to go back on to the pump, which gave them the normal pattern of cortisol. Go to the next slide, please. So if hormone levels and the hormone dynamics are important for good health, how can we define patients in whom they're abnormal? Well, what I've already shown you is a single blood test is completely useless. It tells you absolutely nothing. What about dynamic function tests? Well, these are complicated to do, and interpretation can be quite difficult. And surely what we actually want to know is whether or not your levels of hormone throughout the day are normal, rather than when some artificial test is being done. What about multiple sampling? I bring people in and have multiple blood tests, and this has to be done in an investigation unit. This is abnormal to begin with, and patients rarely sleep, and so the data you get from this are very inaccurate. Saliva testing across the day, that can be quite useful, but the problem is that we can't do it when you're asleep. Getting saliva samples from you when you're asleep is impossible. And as I've shown you, one of the most important times of day for cortisol is what happens when you're asleep. And so we're just unable to do that. So how can we achieve automated sampling in a home setting? And the next sample, the next slide, please. So what we've been able to do is build a device that basically has a little catheter, a very small catheter just under the skin, and we can infuse saline through this and we can collect it. Next slide, please. And this basically is the device. It's called Wearable, and it's made by a company called Dynamic Therapeutics. And basically we can pop this on you. You go home, you do go to work, you sleep when you go to bed, whatever you do, you just do normally. You come back in 24 hours later, we take it off you, and then we have one sample every 20 minutes from you throughout the whole day, measuring your hormones. In this situation, I'm measuring cortisol, but we can measure many other things as well. Go to the next slide, please. So it's worn around your waist, and it's say the saline goes in and comes out, and we collect these samples over the 24 hours. Next slide, please. The first question is it comfortable? Do patients like it? And basically you can see here, so everything in blue is you agree, and everything in red you disagree. So fitting was comfortable. Everybody thought fitting was comfortable, almost everybody. Carrying was easy. Normal activities maintained. It was painless to wear. The noise was totally acceptable. It was easy to sleep with. Night noise was acceptable, and people would be happy to wear it again. So it's something that was very acceptable to the subjects, and practically all of the subjects said they'd be more than happy to do it another time. Next slide, please. So we then continued this work, and we worked with our colleagues in Bergen, in the Karolinska Institute, and in and in Athens. And we looked in large numbers. We used this in large numbers of normal people. Can I have the next slide, please? And basically, I'm showing you here normal cortisol levels in 214 people over 24 hours. You can see the individual, each light colored line is an individual. The dark line here is the median of all of the samples, but you can see the huge inter-individual variation that you have across the day, which is why taking a single sample or even 2 or 3 samples is actually going to tell you very little. So that is what we can see across the whole of the 24 hours. Have the next slide, please. Because we have a sample at each time point, we can measure all sorts of different things. And this is just a sample measuring, this is showing you the levels of 1, 2, 3, 4, 5, 6, 7 different steroid hormones. Blue means the levels are low, red means the levels are high, and this is a clock face here. So you can see this is midnight here, 3 a.m. You can see the levels of all of these hormones are very low at nighttime. And then as you come around to about 6 a.m. and onwards, all of these hormones get higher and then they get lower during the day. So you can see these patterns, these daily patterns of all of these hormones. What happens in disease? Can I have the next slide, please? This is what happens in Cushing's disease. So again, low is blue, red is high. And you can see the circadian rhythm of all of these hormones is completely disrupted. And one of the first things that happens in Cushing's disease is that you lose your normal daily pattern of adrenal steroid hormones. Can I have the next slide, please? Is it good for diagnosis? Well, what I'm showing you here is 4 patients with pituitary Cushing's disease. Now, the normal range is here in the gray color across the day, and the orange color is of an individual patient. And you'll see 1, 2, 3, 4, those 4 patients are hugely abnormal. So in terms of diagnostics, this is incredibly useful. We can diagnose Cushing's disease, for instance, very easily. On the next slide, please. This is similar. These are patients who have adrenal Cushing. So this is Cushing's disease, where the primary problem is a tumor in the adrenal rather than the pituitary. And again, these are in purple, and you'll see the levels of cortisol across the day. And particularly important to us is that the levels are always really very abnormal overnight. And overnight is the time which is critically important for us for our diagnosis. Next slide, please. The other thing that's really interesting about this is we're taking no blood from the patient at all. And that might not be so important with adults, but with small children it is. And it means that we can do prolonged studies in neonates, for instance. So have the next slide, please. So, well, this one isn't a neonate, but this is a 1-year-old child who's undergoing heart surgery. And you can see these huge pulses of cortisol that's happening after heart surgery. But it's just to show you that because we're not taking any blood, we can do these studies in even very, very small children. And a neonate only has about 70 mils of blood. So if we start taking multiple blood samples, you'll kill the child. Whereas this, we could take multiple samples and there's no problems at all. And we can do diagnostics in the children very easily. Next slide, please. So what else can it do? Well, one of the things that's really important is that when we're actually giving you treatment, we really need to be able to monitor whether the treatment we're giving you is appropriate. We give you hormone treatment, but we don't measure what's happening across the day. And we often don't know really whether or not, a patient will come back and say, oh, doctor, you're giving me this treatment, but I'm just not feeling well. and the doctor will take a blood sample and say the blood sample's normal. But actually what you really need to know is what's happening across the whole day. So can I have the next slide, please? I've shown you how urhythm can be interested in diagnosis, but what we want to know is whether it's useful then in personalized therapy. Next slide, please. And this is just to show you what happens in a patient who is hypoadrenal. This was a patient with Addison's disease. So the blue line is the normal range. This is the subject, has one dose of cortisol in the morning, another dose in the afternoon, and that's, all quite well within the normal range. But then at nighttime, look what happens. The levels go very, very, very low indeed. And in fact, he only of course, takes his first dose in the morning after he's woken up. But there's this period here when his levels of hormone are extremely low. And not surprisingly, because cortisol is an anticipatory hormone and needs to go up before you need it, when you wake, it should have gone up before you wake up, but it actually goes up after you wake up. And so a lot of people feel really awful in the morning because they haven't had the cortisol they need before they wake up. So that's this patient, but every patient is different. Now, the next slide, please. This is another patient. This patient actually is from Norway and is taking cortisone acetate. But the important thing is he is taking doses of cortisone acetate here, 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 and here. And in the morning, he isn't taking one yet, but he has a rise in cortisol. He's got some residual capacity to make cortisol. His adrenals are still working a bit. And this for him is really important because he is having a rise in cortisol, even though we're not treating him in the morning. So it means that it's not as urgent that we give him some treatment overnight. The only thing I want to get across here, or to get across to you here, so I didn't bring the pointer. So this is where he's having his own endogenous, his own self-production of cortisol in the morning. And what I want to get across here is every patient is different. Every single patient is different. And unless we know what has been happening to their hormones across the day, we can't know whether we're giving them the ideal hormone replacement for themselves. On the next slide, please. So basically, what I'm wanting to get across to you is that we're moving into a different world now. We're moving into a world where we can have wearables. Now, you've probably heard about the wearables for measuring blood sugar. A lot of diabetics take a wearable which can measure your blood sugar across the whole day, and which is completely transforming the treatment of diabetes. We now have a wearable that can measure cortisol and multiple other hormones across the day. And this is going to change the way that we're able to diagnose treatments, because sometimes treatments, people can be very difficult to diagnose when they've got mild disease. We will be able to measure it across the whole day. And not only that, when we treat you, we'll be able to see whether we're giving you adequate treatment and whether the treatment we're giving you is actually doing what we think it should do. And the important thing there is that when the patient comes in and says to the doctor, I might be on your therapy, but I'm just not feeling as well as I should, we will then be able to see whether or not that patient is feeling unwell because they've got something else going on, or because actually the pattern of hormones that we're giving them isn't as good as the pattern of the hormones that we should be giving them. So I think we're moving into a new era, and I think that this is going to be really a transformative era when we can really greatly improve the way we diagnose and treat patients. Thank you very much.